Get started. On behalf of the Community Technical Assistance Center of New York, it's my pleasure to welcome you to today's webinar, Parental Conflict as a Traumatic Stressor for Children and Adults, Awareness and Ways Therapists Can Intervene. My name is Jim Rodriguez, and I'm the Director of Trauma-Informed Services at the Community Technical Assistance Center of New York. And this offering is part of an informal series that we're calling Big T, Little T. So when we think about trauma, the long list of ACEs that we're all familiar with, I hope, adverse childhood experiences, and we think about categories of traumatic events or adverse childhood experiences like child abuse and neglect and sexual abuse, emotional abuse, parental mental illness, parental incarceration, and domestic violence, and separation and divorce. Sometimes separation and divorce might often be thought of as not as serious, right? It's and because it's so common. But of course, we all know that separation and divorce can be quite traumatic for many children, and can be as traumatic as any other ACE that young people may be exposed to, especially young children. So to shed some light on how parental conflict in the context of separation and divorce can be traumatizing, we have Dr. Kristin Carruthers. Dr. Carruthers is a clinical psychologist, primarily based in both Atlanta and New York. She has expertise in cognitive behavioral therapy and behavioral interventions. She completed her pre-doctoral internship at Columbia University Medical Center and her postdoctoral fellowship in trauma-focused cognitive behavioral therapy at St. John's University. She also served as a psychologist in the school-based mental health program at New York Presbyterian Hospital. And that's where Kristin and I met, and we worked together for a while at the school-based mental health program. And those set of experiences led her to the Child Mind Institute at NYU, where she served as senior psychologist in the ADHD and Behavior Disorder Center. And she is currently in private practice at Peachtree Integrated Psychology. And she's an assistant professor of psychiatry at Morehouse School of Medicine. And as a clinician, she provides CBT to children, adolescents, and adults. She also provides co-parenting therapy for families experiencing high conflict. So she has a lot of expertise in this space. And just to clarify, and Dr. Carruthers will also clarify this, when we're focusing on high conflict separation divorce, we want to be clear, we're not talking about domestic violence. Certainly when there are for victims and survivors of chronic domestic violence, oftentimes the interventions require a different approach and a different set of strategies to address the needs of families and children impacted by domestic violence. In this case, we're going to be focusing on, again, high conflict separation divorce, where yes, there may be issues of violence, but not chronic domestic violence. Dr. Carruthers will kind of clarify all that in her presentation today. With all that said, let me turn it over to Dr. Carruthers. Kristin.
Thank you so much. It's my pleasure to be here, and I really appreciate you for inviting me. I'm Dr. Kristin Carruthers, as was stated. I'm licensed in Georgia and New York and work with lots of families, especially children who've been impacted by high parental conflict. And so I'm really appreciative of Dr. Rodriguez for inviting me to talk to you all today. So as we go through the talk, I'd like to ask you to just keep an open mind. If there are things that confirm your previous experiences or your beliefs, please let us know in the chat. If there are things that are surprising to you or that are kind of in opposition to things you've heard before, please also let us know. There will be a period of time at the end where we will have time for questions and answers. And I'll be happy to address any questions that you have at that time. And so let's get started. Okay, so I'm going to give you all an overview of, you all know this stuff, okay, of trauma, ACEs, and how they contribute to childhood, to developing children, also how these impact how divorce, parental separation impacts kids. Want to really leave you all with some practical approaches for managing these difficulties with your patients and knowing when to refer out and how to seek additional training and support. So again, as was previously stated, we're not focusing on domestic violence here because there's a whole nother body of literature related to domestic violence and intimate partner violence and how that impacts kids, but we're really going to talk about separations and the conflicts that children witness as a part of that, okay? So we know that trauma is a natural emotional response to an uncontrollable stressor during which there is either perceived or actual threat or harm that occurs. One of the things that I learned in my postdoctoral training was that when doing trauma-focused cognitive behavioral therapy, we're really focused on the child's subjective experience of the trauma. And so people may disagree about the specific events that occurred or the order of events that occurred. But when we think about trauma, we really want to focus on the person's subjective experience, because it's that experience that influences how they feel about different situations, how they react in different situations. And so we'll talk about the difference between what is looked at from a forensic judicial point of view versus what is a therapeutic point of view. Okay, so we know that traumatic stressors can be acute, complex, or chronic, right? An acute stressor or acute traumatic stress is something that happens once. Complex is something that has maybe multiple components. So not only was there a divorce, but then there was a death, and then there was a move that occurred. And chronicity refers to the time span or for how long a person was exposed to the traumatic stressor. So we know they're acute, complex, or chronic traumatic stressors, okay? More specifically, we know that there are different forms of trauma that can be experienced. So there's been a lot of research recently on epigenetic traumatic stressors. And so those are traumatic stressors that impact gene expression. So they don't change genes, they change the way genes are expressed for populations of people who've been exposed to a similar trauma. So people who are descendants of individuals who were enslaved. There's evidence of some intergenerational transmission of traumatic stress that is shown up in genetic expression. People who are survivors of the Holocaust, their offspring, there's also this epigenetic trauma that's been documented in the literature. There's trauma that comes from shock, from like a critical illness or an injury. Developmental trauma, that's the result of like something that might seem to be an invisible childhood experience, maybe mistreatment or abuse that's been reported on multiple occasions or that's gone unreported, something that's impacted a kid early on in development. We already talked about complex trauma, so traumas on top of traumas, right? Collective trauma, so that's trauma that may be reciprocal or experienced that's occurs for a group of people. So when we think about what's happened in Buffalo, that's a collective trauma that's being experienced by a community and that has reverberating effects to people across the African diaspora around the world. There's systemic or institutionalized trauma, which is a result of systems that have been put in place to disenfranchise people and then result in emotional experience and stressors that are disproportionately impacting one group versus another. And then generational trauma. So when we think about meeting with an individual client or patient and doing a genogram and seeing that there are generational patterns of the same type of trauma or the same type of abuse occurring over time, okay? When we think, before I get started with that, when we think of high conflict separations or divorces, I posit that these are also traumas. Dr. Rodriguez and I had a conversation about big T versus little t, right? So people tend to think of a divorce or a separation as just something that a kid will just get past. The difference that occurs when you have a kid who's being impacted by a high conflict divorce or trauma is that that is not just an event that occurs one time. Typically, there's a pattern of relationship between the parents that gets perpetuated for many years, even into adulthood. And children are put in positions where they're made to feel responsible, where they may have a loss of relationship. And so I'd like to show you a video about what can be traumatic for kids in the process of divorce or separation. I'd also like you to be aware that this is not something that just happens for the children of parents who are married. So parents who were never married, but who live together and then experience a separation can also exhibit the same patterns of behaviors, and kids are impacted by those as well.
Dear Mom and Dad, know that you are hurting. I'm hurting too. I feel and feed off your tension, fear, and shock. Although I am young and cannot express verbally what is happening in our lives, I'm still feeling the impact. My heart is broken every time I have to give up a parent. My sense of security is lost. Please don't assume that I am resilient. Please don't assume that my life will be exactly as it was, and that I will continue to feel the same love from both of you. I am a human being just like you. My needs are just like yours. I need love, attention, nurturing, stability, consistency, affection, understanding, patience, and mostly to be wanted. When you fight over me or put me in the middle of your argument, you are sending me the message that winning with each other is more important than my life. I am learning from you that it is better to be right than to be loved. You are teaching me that I came from a person who is unlovable and wrong, and that I am somehow wrong too. When you confide your hurt in my heart, you are storing up adult pain and robbing me of my childhood. You are taking away my belief that love is unconditional and replacing it with a message that tells me to become hard and not to love because I will get hurt and not be able to recover. You may not understand this today, and I am so small that you are not thinking about my future, but you are putting me at a greater risk of getting a divorce myself. At times, you are risking my safety to fill a void in your heart. My safety is your job. Without you and your protection, I am unshielded from the world. This will manifest in irrational fears for me, because I will stay in a state of fight or flight for most of my life. Someday, this initial shock will wear off, but how you choose to parent me through this crisis will never wear off. I will either feel your sense of selflessness, support, protection, or I will have a scar on my heart with a message that reads, "Good things happen to good people. I must be bad." Thoughtfully, the child of divorce.
So I want to let you all know that this is not a call for people who are in toxic relationships or abusive relationships to remain in those relationships for their children's sake. This is a call for parents to understand that when they make the choice to engage in relationships, it is very important that they are fully aware of the messages that they send to their children about who their children are and who their children's parents are, right? So we can be in loving relationships and send messages that it is appropriate to have boundaries, to care for one another, to respect people's wishes. We can have relationships that break apart that also do the same thing. The issue arises when parents lose sight of the child's best interest and become focused on their own needs to the point of exposing their kids to undue conflict and negative interactions. Okay, now let's figure out how to slide. Oh, there it goes. Okay, so when we think of ACEs, adverse childhood experiences, these are potentially traumatic experiences that occur from birth to 17. We know they can affect kids for years and that the effect is multiplicative, so that the higher your ACEs score, the number of adverse childhood experiences you are impacted by, the more negative outcome you have in terms of your physical health, your mental health, your employability, your economic attainment, right? So when we think of high conflict divorce, we're looking at the loss of a parent or parental relationship that's happening because parents have decided for some reason to no longer be together. The difference between a divorce that's amicable and a divorce that is high conflict is that in high conflict situations, parents put undue pressure on children to either pick sides, to operate as mediators, which is inappropriate, or overly expose their kids to conflict. When kids are in these situations under which they have no control, they are watching two people whom they love engage in interactions that are harmful for them both psychologically and potentially, like we said, physically, right? We understand that parents' own ability to effectively co-parent when they're in divorce situations is likely impacted by their own adverse childhood experiences, their own experience of parental conflict, their own personality variables, and we'll talk a little bit about that. Okay, so a high conflict relationship dissolution between divorced, separated, or cohabitating parents are traumatic losses that contribute to these adverse life experiences. And I would argue that high conflict divorce could hit more than one marker in terms of being experienced as an adverse childhood experience. Okay. So when we talk about how divorce is processed by kids, what do they take in? I want to show two different clips that I believe present views of how we would like to think about kids and their experience of divorce and what happens when a divorce is not a high conflict divorce versus what kids experience in the context of a divorce that is high conflict. Oops. Be patient with me while I figure out how to make my video work. One second. Can't see my cursor. Oh, there you are. Sorry for the technical glitch. Okay, I'm ready.
Little children, big challenges, divorce.
Hey guys!
Oh, hi, Gordon!
Hey, what you doing?
Oh, drawing pictures.
Oh, really? Of what?
Of our homes. Yeah, yep, we're drawing where we live. This is a picture of Elma's apartment. This one is where I live with my mommy, and this one is where I live with my daddy. But Abby, why don't you all live in one house together? Well, because my parents are divorced. Divorced? Mm-hmm. What does divorce mean?
Well, divorce means that Abby's mommy and daddy aren't married anymore.
Huh. Emma doesn't get it. Me neither. When my mommy and daddy were married, we all lived together in one house. But then one day they told me they had some grown-up problems. Problems they couldn't fix. Mommy and daddy told me that they decided not to be married to each other anymore. But they said they both still love me very much. I've got big feelings.
Okay. Now, the way that information was presented or that child explained was quite developmentally appropriate. Parents came, had a conversation and said, you know what? We have grown-up problems and we decided not to be together anymore, but we both still love you. That seems like a very easy line to give. And I will tell you that in the work that I do, it is a line that many of the children and adolescents and adults that I work with never heard from their parents. As a result of never hearing that from their parents or hearing that, but seeing behaviors that were opposite of what the words that they were given were, those people experience higher rates of anxiety and depression. They have difficulty in terms of their ability to relate and interact with their own parents, their feelings of resentment about the things that they were exposed to, the information that they were provided that was not necessarily developmentally appropriate. And so I want to show you another video of some children actually talking about their process and what they experience with high conflict divorce.
Like something that wouldn't happen to you, like a car crash or your house catching on fire.
You're kind of confused. You don't really know what's going on because they've been together your whole life, and it scares you at the same time, and just everything is chaos basically. You don't really know what's going on, and it's just a really scary moment.
My parents were always fighting, and I always told them to stop fighting.
They would like fight, and my dad, he would leave out screaming. They would be fighting, there would be things thrown, and sometimes I would have to go over to one of my friends' house, or I would have to just sit in my room with the door closed and listen to it.
It just never feels good to
just have that feeling that somebody might be in the house, but it's not actually that. It's just your mom and dad.
I always told them to stop fighting because I didn't want them to separate.
They were just like yelling and screaming. I was so sad. I wanted them to stop, but there was nothing I could do because I was so little. But
it was really hard seeing them fight with each other and just argue, and things weren't perfect like they always were.
Why were my parents always fighting back then?
There was a lot of fighting. They never got along.
They went fighting again, and I said stop it, but they kept fighting.
I saw my mom they were physically fighting.
I went to go check what was happening because I heard lots of screaming, and I saw them fighting, so I got scared.
So it can be hard to tease apart, is this domestic violence? Is this parents willingly fighting each other? Yes, that is domestic violence. What do kids see? Do kids interpret the arguing as at the same level of intensity as they interpret physical contact? But there were some words, some descriptors those kids used: chaos, sad, scared, not having control, right? So my question is high conflict divorce really only one trauma? If you're experiencing ongoing conflict between parents, and when I say ongoing, I don't mean a period of months, I mean years. You witness domestic violence, you have loss of contact with a parent because one parent refuses to allow you to see the other parent, or tells you that the other parent doesn't want to see you, or a parent stops making contact with you because of the level of negative interaction that they have with their former partner. Investigation or removal by Child Protective Services if there's been findings of neglect or physical abuse, a sudden change in lifestyle, maybe income is drastically reduced and families have to move, kids have to switch homes and schools, a child being coerced to badmouth one parent to another, or to write a letter to a court saying that they don't want to see another parent or one of the other parents again. This endless cycle of court proceedings, interviews by judges, guardians, and attorneys that occurs for years at a time. I would propose to you all that high conflict divorce may not be as little of a T as we think it is. And I know this as a therapist because there are not many people who want to actually do the work of providing evidence-based intervention for these families, because the problems that they experience tend to be chronic and complex and resistant to treatment. So if it's difficult for a therapist to want to work with these types of families, imagine what it's like to be a child whose everyday experience is living in one of these households, okay? If you're a child who's living in a household where they've been exposed to a high conflict separation, divorce, or just the dissolution of relationship between their parents, you're going to have difficulty processing information, excuse me, due to feeling overwhelmed, increases in anxious or negative thoughts, difficulty attending in school or other settings, maybe some anxious avoidance or resistance to seeing a parent who you may believe had some duty or some responsibility in terms of the relationship breaking up. There's grief related to loss. There's already said increased feeling, sorry. There's splitting. So there's stress where you're forced to choose between your parents, even though you really don't want to have to make that type of decision. As a result, a kid might have low frustration tolerance or experience changes in their moods or emotions. They might even engage in self-blame. Their self-esteem might be low, and they might lack confidence as a result. So, why do parents get into these situations in the first place? So, excuse me, this slide really talks about what happens in high conflict divorce situations where children resist contact with a parent, or where a parent tries to make it such that another parent has lower contact. And so there are some things: parenting styles, mental illness, substance abuse, alienating behaviors. I can talk to you all a little bit about what those look like. We don't necessarily go along with the term parental alienation syndrome anymore, but we talk about specific behaviors we can see. So refusal of phone calls, not allowing your kid to attend visits, saying that a kid is sick when they're really not, or saying, oh, the kid doesn't want to go with you, so they don't have to go with you. Telling a kid negative things about the relationship so that the kid will then be angry and take your side, right? So this like tribal warfare that can occur between both parents, or they can be from primarily one parent. And then we've got kids' behaviors, right? Kid level factors. So what is their appraisal of the conflict? How do they think about, what are their cognitions about the conflict and who was responsible? What is their capacity in terms of their age or developmental level? What was their historical relationship with their parent? Were they closer to one parent than the other always? And so now they are more attached to that parent as the separation ensues, right? How much conflict were they exposed to when the relationship was intact? Were they forced to triangulate? Were they reinforced by having a closer relationship with one parent over the other? Are there loose boundaries, right? And other factors like reduction in time, difficulty in terms of economics, and exposure to litigation, right? So are these kids being told everything that's happening in divorce proceedings? Are they being coached in terms of talking to judges, etc.? These are all factors that contribute to maintaining this ongoing trauma, okay? In terms of factors that maintain parent-child contact problems, we look at, it almost reminds me of like the Bronfenbrenner model, where you're looking at the child as the person in the middle of the circle, and then all the different systems, the mesosystem, macrosystem, exosystem that impact that child over time. First, we look at the child's responses to all of these things that have impacted them. So we've got perhaps a humiliating separation for parents, that personality of that parent. And we're talking about the aligned parent. The aligned parent is the parent that the child is more likely to want to have contact with, or who the child might choose to live with. Looking at whether or not the parents have functional co-parenting skills. Are they involved in intense litigation? Are professionals who are involved in the situation, other therapists, also aligned? Teachers, legal professionals also play a role in maintaining these levels of conflict and difficulty with kids being able to have contact with both parents when they're going through a high conflict divorce situation. Okay. We've got some patterns of behavior. When I talk to you all about alienating behaviors that parents may display that keep this kind of cycle going, we've got gatekeeping strategies, right? So from an adaptive perspective, if a parent is gatekeeping by encouraging a child to call the parent that's the non-custodial parent, encouraging the child to attend a visit, if they're encouraging the child to stay out of the conflict, right? That's an adaptive approach. A maladaptive approach would be unjustly restricting contact with the other parent, bad mouthing, right? And we see that this can happen on a spectrum, right? When we're looking at like high levels of alienation, there's this maladaptive restrictive gatekeeping. When we're looking at parents working together so that the child can have an affinity for both parents, we're looking at adaptive facilitative gatekeeping, encouraging phone calls, doing exchanges that are not conflictual, being appropriate in terms of disclosure, right? So these are all some factors. I know I've given you all a lot of information over the last few minutes. And now what I'd like to do is I'd like to shift you into what you can do as a mental health professional to help intervene in a child's best interest. So what are some of the resources that are available for mental health professionals, and what should you be aware of if you're a mental health professional who does not necessarily have the training to work with a child who's going through this type of high conflict situation? What are some things you should be aware of? Okay, so and how do we intervene in the child's best interest? Okay. So first, we need to understand protective factors for children in high conflict, separation, divorces, relationship dissolution situations. These children need their caregivers to create safe, stable, and nurturing relationships, meaning there's consistency, and the children know that they are being taken care of, that they are safe, and they are supported. So even if they disagree with the relationship breakup, they really know what that Sesame Street video said, that their parents both love them. And how do they know this? Not just because their parents say it, but because they show it with their actions. Their parents are able to figure out ways to maintain structure for the child so that the child does not have to then become a parent, okay? Caregivers work through conflicts peacefully. Caregivers help kids work through their problems or their difficulty adjusting to the change in lifestyle. Caregivers engage in parental monitoring, supervision, and consistent enforcement of rules. This is something that is sometimes tough when you've got two separate households with very different rules. We've got to come to some middle ground, basic principles about what we believe as a family, even though we are no longer an intact family. And that is for the best interest of our child, not trying to convince our child to like one parent better than the other. Okay. So I want you to know a little bit about like some practical approaches and how we typically tackle these situations to decrease trauma and to decrease conflict for kids so that they can actually recover and move forward from these experiences. Many children do. When we're talking about divorces that are not high conflict, we do not expect children to suffer long term. But when kids are constantly embroiled in conflict between their parents, think about it. These are the two people who brought you into the world. You're half of both of them, right? And you're being forced on multiple occasions to choose. You're being forced to take in information that may not be positive about one parent from the other parent, okay? We've got informed mental health professionals, the judicial system, evidence-based intervention, data collection, and collaboration. These are the things that we need to do to make things better for kids and adults in these situations, okay? As an informed mental health professional, your job when you come in contact with one of these families is to provide a safe, structured therapeutic space to assist children and parents with rebuilding and repairing. The purpose is not to rehash and to assign blame. It is to help people acknowledge that a difficult situation occurred, validate that there are a range of emotions that people experience throughout the process of that situation occurring, and helping people to understand what they can do now that they've been through that experience. How can they rebuild, repair, and move forward, right? So the process, we want them to get unstuck. It is not your job or the job of a mental health professional, unless that person is a custody evaluator who's been appointed by the courts, to recommend a parenting schedule, to determine fault, to advocate for one party over the other, or to advocate for a child not having contact with a parent. Even in situations of domestic violence, we know that the literature states that children need to have contact with both parents. It may be that that child's contact must be monitored and supervised, and that they are not allowed to have contact individually with that parent, but it is important that contact is consistently maintained, okay? When we take away a child's ability to have contact with a parent, we reinforce anxious avoidance that may not necessarily be helpful for that child long-term. And I'm not talking about safety issues. Safety is another thing. If there is a safety issue, safety needs to be addressed, okay? And as therapists, we have ways that we address safety issues. We are mandated reporters. We make sure that we are reporting and that an investigation occurs. We are not the investigators, unless we are child custody evaluators. And even then, child custody evaluators will defer to Child Protective Services if there are allegations of abuse. Okay. So in the judicial system, the players are we've got the family court judges. We've got guardian ad litems. In New York, there's a statute for guardian ad litems. They actually can engage in decision making. Parent coordinators, in Georgia, New York, everywhere, guardian ad litems are legal professionals. They correspond with judges, make recommendations. In New York, parent coordinators are people who are typically licensed mental health professionals, perhaps attorneys, who have experience working with families engaged in high conflict situations. Parent coordinators in New York are typically the people who can recommend parenting schedules, who make sure that parents comply with recommendations for the court, who make sure that children's needs are being met. In the state of Georgia, parent coordinators do not have the same legal authority, right? But I want you to know that in the state of New York, parent coordinators have authority. High conflict co-parenting therapists, these are mental health professionals who are trained in doing high conflict work and teaching co-parenting skills. We've got reunification therapists who work with children who have been estranged from one parent for one reason or another. We've got family therapists who do work with the entire family, and then the individual therapists of children or parents. Okay, so when we talk about evidence-based intervention, high conflict co-parenting models, family systems reunification therapy, and trauma-focused therapies, okay? So high conflict co-parenting models are typically going to focus on helping parents to understand like the coercive cycle of interaction that happens between parents, that happens between parents and children, and how we can inadvertently reinforce negative behaviors, expecting those behaviors to decrease. But we see that they grow because we are doing some things that continue to maintain them. So parents may send signals that are implicit or explicit that suggest that a child should resist contact with another parent. We call those out and we find out, we discuss ways to encourage relationships, okay? The reinforcing positive and decreasing negative behaviors is also about when children go through these experiences, you may see upticks in behavioral symptoms. You may see upticks in emotional symptoms. And so we want to know what to reinforce and what to avoid reinforcing. For a kid who is anxious, we want to avoid reinforcing them becoming too closely in line with only one parent and saying that they're always anxious when they have to go to another parent. And so we're not going to make them have that contact. No, we're going to do a stepwise approach like we would in a trauma-focused therapy, right? If we've got a kid who is acting out, we want to put systems into place where that kid can get as much reinforcement as possible for their on-task behaviors. We want to validate this is an extremely difficult time and that the kid may not want this change to occur, but that it's occurring, and put things into place so that that kid can know that they will still be able to have a relationship and interaction with the other parent. We teach parents conflict management skills, and we've got to teach them how to compromise and negotiate. And one of the main things about negotiation is that if it's really a negotiation, nobody's going to walk away completely happy, because that means both parties had to give up something they really wanted to come together in the best interest of their child, okay? So always remember, if it's true negotiation, nobody is really happy, right? We both had to give up something. Okay. And then we're going to engage in relationship building between parents and children. So one of the things that I take from the parent-child interaction therapy literature is 5 minutes of special time. And this is a special playtime or a special FaceTime call that occurs on a daily basis, or at least 5 days out of 7, where a parent doesn't put pressure on the child to answer questions or follow commands, but where the parent engages in behavioral descriptions of the child's positive behavior, reflecting back the child's appropriate speech, providing that child with specific praise about things they're doing well, while following behind them in their play. So I'll typically have parents schedule this time, this 5-minute special time. The child will have an activity set up at their desk, and hopefully the parent that's the non-custodial parent that day will have a similar activity set up that they can do while they talk to the child, and while they reinforce the child for being on the phone, for being present, for engaging in activities. Okay. Some more formal interventions are the Overcoming Barriers Camp, which is a program that's facilitated annually, and families have been court ordered to attend this therapy, but basically the goal is to kind of break down these parent-child contact problems and overcome alienating behaviors by having the parents together go through camp. It was suspended during the pandemic, and I believe that the authors, creators, they're working on that, but I'll provide you all with the website for that. New Ways for Family is an online class that is developed for helping parents manage high conflict divorce and co-parenting. So we want parents to learn how to be able to come to the table and understand that their conflict actually does more harm to their kids, and that it would be more beneficial for them to learn ways not to get along, but to compromise and to negotiate. So we're not telling you you've got to change your feeling about the person, but you've got to shift your focus from your relationship ending to what's best for your child. Your child is a person with feelings, with beliefs, with personality, and it's their turn to be poured into. Your relationship is over. Focus on your child. Okay. Reunification therapy is when I talk about this, I'm going to talk about the family therapy model that reintegrates family members who were previously separated. In order for it to be effective, though, it's got to include both the favored parent and the rejected parent. What we find often is that favored parents may undo some of the work that occurs in reunification therapy because they constantly challenge the therapist about the point of the therapy. They may undo some of the work that's been done in the therapeutic sessions by afterwards asking children to submit an affidavit to the court or a letter to the court electing to be with one parent over the other, right? It is hard to change family dynamics, right? And so we're going to prescribe some very specific behaviors to make sure that parents and children maintain contact and that one parent doesn't lord power over the other in terms of a child being able to have an interaction that is appropriate, okay? Typically in reunification therapy, you report back to a parent coordinator, the guardian ad litem, or the courts about progress and whether or not parents are really on board with trying to repair. This is basically a repeat of that. Co-parent work will start first. And this can be pretty tough because when people come to the table, they're not necessarily in a position where they want to negotiate or where they want to see the person that they believe has kept their child from them, or they may not want to see the person that they are so angry with from a previous divorce, right? But we've got to help them establish an agreement, help them to understand what is developmentally appropriate information for a child, what is not developmentally appropriate information for a child, help them to establish structure and routine, because we know that it is very important when kids have been through a traumatic life experience that they have structure, routine, and consistency following that event so that they know that they are safe and that their parents have the ability to protect them, right? And then we're going to provide families with structured recreational activities and new opportunities to build a new perspective, right? So we've got these historical memories, these things that have happened to us, but how can we rebuild and move forward, okay? If you're working with a child or adult as a therapist, the Tfcbt model is an excellent model for children and teens who've been through a traumatic, a high conflict divorce. What I will say though is with any Tfcbt model, we don't want to implement the intervention until we know that the traumatic stressor has ended, right? So it's not an idea to start a Tfcbt while parents are still involved in litigation, right? While parents are going through a litigation, you are more focused on teaching specific coping strategies to cope adaptively with an uncontrollable stressor, right? So a lot of validation of moods and emotions, a lot of coping skills, and then some parent coaching. So if you got a kid who's coming in, they're constantly saying, my mom is listening in on my conversations. As a therapist, your role would be to say, thank you for telling me that. I want us to figure out a way that we can talk to dad about how it makes you feel when you think he's listening in on a conversation, right? Working with a child or adolescent to kind of build that agency. The child may be scared because perhaps when they leave your office, the parent is questioning them about what they told you, right? So we want to be aware of all these things. Ultimately, we want to work towards giving our clients or our patients agency, empowering them to be able to have these conversations. And if they're in a position where they can't have the conversation, then it's a good time to schedule a collateral session with a parent or both parents to talk about barriers to allowing the child to have their own safe, structured space to have contact with that other parent. In terms of conflict, high conflict and domestic violence, the alternatives for families, cognitive behavioral therapy model, alternatives for families, CBT, it's an evidence-based approach that's been used for years for families who are in these high conflict situations, and they'll work with both parents. I've included the website here. And if you are a therapist and you find yourself in this situation and you want to know what are the guidelines in terms of where are your limitations in terms of your ability to practice, the Association for Family and Conciliatory Courts, AFCC, has a website with a wealth of resources, guidelines, research data, articles that can help you to understand what your limits should be as a therapist. Okay. This piece is really big for me. Special considerations when you're partnering with other therapists. Don't want any of us to assume that we are all, that we've all been exposed to work with high conflict divorce families or parent-child contact problems. This is work that I kind of fell into, but this was not something that I was trained in graduate school, nor was I trained in it on my internship or postdoctoral experience. It's something that I got training in as I became a professional and started to get more clientele who presented in this way. And that's when it's good to go to an AFCC or to go to the Family Law Institute for your state to learn more about what the literature says is best in terms of working with families through this trauma, right? When you're working with other therapists, you want to really be aware of the therapist's willingness to engage in collateral sessions, even if they're operating from a different theoretical orientation, right? And you may not even need a collateral session, but a collateral contact. So is the therapist willing to have a professional conversation about dynamics that are at play in terms of the family relationship? Is the therapist willing to perhaps accept a different perspective? Are you as a therapist willing to accept a different perspective? So remember, as therapists, yes, we advocate and we empower our clients, but we don't want to be so aligned with our clients, that when we get additional information about things that can help the family system improve, that we're not willing to accept any of that feedback or any of that information. So we want to really be open. It's important to understand that your client's perspective may not take into account other contextual factors, etc. If you're in a Tfcbt model and you're doing a trauma narrative with a kid, and remember, that's about subjective experience. We don't care what the parents said happened first, second, or third. We want to know about this kid's subjective experience, and we want to help them engage in cognitive processing around that, right? In this situation, when we're talking about working with other therapists, we are working as scientists, right? We've always got a hypothesis about what could be going on, and we're collecting as much data as possible so that we can all be informed about the best ways to help a family move forward, so that we don't get stuck in our own position to the disadvantage of the family, okay? We want to be really wary of sexual abuse claims, right? Sexual abuse claims should be reported by that parent to ACS Child Protective Services, right? It is not your job as a therapist to do this investigation. If you become aware, we're all mandated reporters. So if you become aware of something, you have to make a report. But we want to make sure that we are not, this is what I want to say. In many of these high conflict situations, we get claims of abuse that may be warranted, that may be unwarranted. Your job is to defer to ACS and Child Protective Services, okay? It is not your job in high conflict work, co-parenting work, to process that out, right? Once an investigation has been done, you can move forward. You can consult with child advocacy centers if there's if there are allegations of abuse, etc. Okay. Basically, you need to know your lane and you need to stay in it. And that's about as nicely as I can put that. How do we help families cope forward? Okay. We do so by helping children first understand that the issues in their parents' relationships are not their fault. They are not responsible. Many times adults and kids will say, I didn't ask to be here. You know, maybe if I wasn't here, they wouldn't have these issues. So then maybe I shouldn't be here. Okay, pause. We want children, adolescents, adults to know that these two individuals who were at one point somehow involved and had them probably had their own issues long before the child came into play. The child is never responsible for their parents' relationship. They are not responsible for the physical or emotional care of their parents. Parents may put undue pressure on a child to care for them emotionally or physically, right? There's a difference between assistance and caretaking, right? We are not trying to build parentified children who have become parentified in the context of high conflict, right? Children can love both parents and they do not have to take sides. If a parent forces them to choose, that parent is making a poor choice. Okay. Some kids will hide when it's time to talk to the non-custodial parent because they know that it triggers the custodial parent and vice versa, right? That's a sign for me that they're receiving some implicit or explicit messages about whether or not it's okay to have a relationship, right? Kids can have healthy relationships in the future, even if their parents' relationships were flawed, right? So just because you went through this experience doesn't mean this experience becomes you, okay? And it's okay to speak up. And I sometimes let parents know that I'm going to tell their children these things so that when they hear them, they can take their anger out on me, right? Children will still report, if I say this to my mom, she's going to get mad. If I say this to my dad, he's going to get mad. And I understand that. And some children may not be able to do that because they're already anxious. They're already under pressure. But I want them to know that it's okay to tell a parent that they don't want to know what happens in court, that they shouldn't really be told the details of divorce or custody proceedings. It's not appropriate. When a parenting plan has been established and it's been determined what the time split will be, that's the appropriate time to give a kid information about what's going to happen. I have many kids who come in and they know that the parent's court date is coming up and they're on pins and needles and they're worried sick about what's going to happen in court. Kids who are concerned about how much money their families are spending on proceedings and whether or not one parent has enough to make basic ends meet, right? These are details that are not appropriate for children and adolescents to know, okay? As therapists, we want you to encourage parents to provide information that's developmentally appropriate, avoid oversharing or providing too much detailed information. If you're working with a college age child and that child wants some more detailed information, I would also say that you want to be really careful. Remember, people's brains aren't fully developed in terms of their frontal lobes, their ability to process information until they're 25, right? So think about it this way. You are not under any pressure to give your kid, your children, all of the details. And that does not mean you're telling a lie. That means you have boundaries and you are respecting the fact that their relationship with a parent may be different than the relationship that you had with that person. You want to understand parents to understand their own reactions and know their own history and how their own history of adverse childhood experiences, their own history of parental conflict, their own history of all these other things can impact their outlook and how they're parenting their kids. We want parents to avoid making overgeneralizations until they have specific details, right? So if the parents really don't know how the parenting plan is going to work out, then we're not going to make an overgeneralization and say, oh, they probably won't give your mom any time because they know she's a bad parent, right? Inappropriate, right? We'll know more once your mom and I go to court. I'll let you know when that's necessary, right? And parents should be encouraged to consult qualified mental health professionals for support as needed. It's always important to reach out. And I've given you the names of some good places that have some good information, okay? So for kids and adolescents, we want gradual exposure, right? So if a kid has been estranged from a parent, we want to make sure that they are exposed gradually. That doesn't mean they're not going to see that parent for another 6 months. That means they may start by having some FaceTime calls. They may transition into having some in-person visits. They may then transition to having some overnights, etc. Right? That's in the case where a kid has been estranged from a parent. All kids need structure. They need to know you're going to be here for this day and then you go here. They need to know what the routine is and that people are going to be consistent and they're going to show up for them. Okay. That is the best way for them to be able to move forward from this type of experience. some resources for you all: the Association of Family and Conciliation Courts, the New Ways for Families online course. You can refer parents to this if they're in a high conflict situation, and the Overcoming Barriers camp. Some very good articles, resources for yourself or other therapists who may be working with families in experiencing high conflict, custody disputes, intervention-based articles as well. And then my contact information, should you have any questions, I can be reached here, and that's my website. And I'd like to just thank you all for participating, and I can take questions.
Okay, so thank you, Kristin. Just a lot and very thought-provoking. So folks, please feel free to chat in any additional questions, but we had a few come in during the course of the presentation. Okay. And I'm just going to go through some are very specific. And
okay.
This first one came in. I was once informed by a psychiatrist that if a breakup is in the works, it is best to do it prior to the age of 5 years old for the child. Would you agree with this? So I realize, sort of the developmental aspects of this are there. You've talked about this, but what are your thoughts about that? And just generally the timing of divorce and separations and what impact that may have on.
So I don't know that there's like concrete literature about the timing of divorce. I think what's most important is how the separation occurs, right? So if it's conflictual and it happens at 4, the kid may still encode some of the conflict that happened and have memories about that exist right throughout childhood. In addition, that kid is going to be highly likely to still experience you all's conflict, even if you are broken up, right? So I think it's less about the age of the child when a breakup occurs and more about the level of conflict, right? So if there's a breakup at 12, but there's a low level of conflict, relationships are maintained, the kid is reinforced to have relationships with both parents are able to co-parent, then that kid, in my opinion, you would likely have a better outcome long-term in terms of their conceptualization of what happens in divorce than a kid whose parents divorced at 5 or 4, but who's been in conflict and litigation every 2 years when there's a disagreement about child support, or there's a disagreement about the parenting plan, or there's a disagreement about the custody arrangement, right? So it's really about the level of conflict that the child is being exposed to, and less about the age at which the divorce or the separation occurs.
Yeah, and my guess is that that comment that was received is probably also speaking to the issue of, the younger the child is, the more likely it is that they'll be used to the living with divorced or separated parents, right? But I think your point is well taken. Of course, it's not about the timing so much as the level of conflict. Again, a very specific questions, and I think this could occur both with in gay families or straight families, but absolutely. This is specifically referring to gay families. Gay families wanting children and not living together from the start, but with conflict as well. So I think the idea is, I think as you addressed earlier, there may be co-parenting situations, and again,
and I work with all families, and so I work with heterosexual and gay families, right? Where their people have been married or never married in both situations. And really it's about, like I said, there are some about conflict and messaging to kids, right? And I see that across the board. Like it really doesn't, in my opinion, I don't see it in my work. I have not seen a difference between how the conflict impacts kids, whether or not their parents are same sex or opposite gender, same gender or opposite gender. Like it's about the level of conflict, right? The positioning that parents do in terms of, well, this person is this, and you shouldn't want to be with them, or look at what they did, right? So yeah.
Okay. I'm sorry, just looking at some more
No
questions
problem.
coming in. There are some kind of systems questions. So I think your expertise in understanding the system and the resources that are available. So one question that came up is, resources in many states regarding parent coordinators, custody evaluators, and all this are cost prohibitive for the average family. Are there any states that have such services built into the court system?
Yes.
Any states that incorporate outside mediation as a regular part of that? So yeah, it's a great question because, right, so a lot of these services. So your thoughts on that?
Excellent question. So I was just at the Association for Family and Conciliation Courts conference in Chicago last week, where states across the US and Canada were represented. Each state operates differently, but most, so like here in Georgia, the court systems are run by county, right? And so in the Atlanta area, there's like 5 or 6 different counties, and each county has their own way of dealing with like cost prohibitive services. So where I live in Fulton County, there's an organization called the Atlanta Volunteer Lawyers Foundation. They train guardian ad litems and ask those guardians to provide their services at a low fee or pro bono rate, right? In Illinois, I know the Cook County, which is where I was raised, has a whole program which works with families who are low income, who may not have the resources to get the same levels of support as families who are higher income. In the state of New York, I believe that AFCC has a chapter, and that chapter can help direct people in terms of finding low fee or low cost options for guardians and parent coordinators. And those people can often be appointed by the courts and be officers of the courts, and typically that may be a way to get a lower fee option. And so you really have to know what's going on state by state. But this is very expensive. Like, it's very expensive if you undergo these processes. Most of the guardians in the state of Georgia are all attorneys. So not only are you paying your family lawyer, you're also paying a guardian, and you may share that cost with the other parent if it's determined by the judges in your case that there needs to be a guardian in place. If we say you got to go to, if they say you have to go to high conflict co-parenting, if they say you have to have a parent coordinator, these are all things you have to pay for to fight in front of your kids.
Yeah, and it sounds like there are many ways. I think this goes back to that graphic that you showed, in which many ways in which the systems can align to promote these cycles of conflict. Yeah.
So we have legal professionals who become aligned with their clients in winning, right? And then lose sight of the child. So from that first video I showed you, like, there's a child here. There's a real person here who's impacting all of this.
Great. So there's so many great questions coming in. This one, how about blended families? When a child is visiting a parent who is married and whose spouse has a child, the spouse's child is very close to the parent of the biological child who visits. I'm not, maybe a little bit of a general question about blended families and how you address that in your work.
Okay, so when we have blended families, the goal is really, we're great. We're super glad that the kids are all getting along. The goal is to not triangulate the step parent, right? So to make sure that the step parent doesn't become triangulated between the parents' conflict, right? So typically when I work with blended families, I want to make sure that I get the biological parents or the kids' parents, the parents of origin, on the same page, teach them the same techniques. And then separately, we may bring in a step parent, not to engage with both parents of origin, but to engage with me and their partner so that I can teach them the skills that I've been teaching the parents of origin or biological parents, right? I avoid having all of the parents in one room at the same time, unless the parents are typically accustomed to operating in that way. So there are some blended families I work with where there was a divorce very early. So maybe at age 2 or 3, the step parent has been in the picture since that age. The step parent and the biological parent have a good relationship, and we're able to work together towards making things better for the kid.
Thank you, Kristin. So I'm reading through this one. It's a very detailed question. I'm just going to read it as is. And I think I get the gist. I have worked with teens ages 14 to 17 who find they begin experiencing similar conflicts and challenges with the rejected parent that the favored parent had when together married. So I'm hearing parallel processes.
Parallel process, maybe some personality factors.
Exactly. This can be triggering for the favored parent to hear about and has led to teens refusing to see the rejected parent or no longer wanting to live with them in accordance with separation agreements. In some cases, the parents have managed to co-parent without conflict up to this point. Can you speak to ways of supporting the need? So yeah, so I guess what I'm hearing here is when the child's stuff comes up and maybe these dynamics are now playing out, it's not necessarily conflict, but the child is finding these difficulties. Interesting.
And that's a really great question. And I work with some families. That's when I believe family therapy is really warranted because, what's happening is that the parent who is not the favored parent may not realize that they are interacting with their child in a way that's reflective of like, not understanding developmental changes. And so in some cases, when we get to this teenage years, a parent continues to parent as they parented when the person was a child. And when you see that, there may be some over control behaviors, there may be some resistance to acceptance of new ideas, etc. We've got to really work with that parent and that child so that that parent can understand, hey, there's some developmental changes. This is not a baby anymore. This child is 14. And this child has their own thoughts and their own experiences, and they're starting to experience some patterns in terms of their interactions with you. I don't even bring in what the favorite parent experienced, right? I talk about what is the relationship dynamic and why there may be a shift and how that parent may be missing out on cues that developmentally things have changed and they have to shift. They have to adapt to their child now. Or in terms of personality characteristics, they may be more rigid and they have to be aware that their kid's perspective is also very important. So this is a time when anytime there's like resistance to continue visits or to maintain what was once a parenting plan on the part of the child, I believe the child and that parent need to do some family therapy.
And again, that was the person's, how do you support families with these unique needs?
Yep.
Just to follow up on that for the person, would you sort of do family therapy with where there is the difficulty with the rejected family, the family as a whole, the youth, the young person, and that rejected parent who they're having struggles with?
Yes. Okay. So there's a couple different ways you can do it, right? So I've worked on some cases where this difficulty arose, and the child and that parent that they were struggling with went to family therapy with a different therapist, where I continue to do the high conflict co-parenting therapy with the parent who's favored and the parent who's non-favored, and talked about the parent who was favored expressed concerns to the parent who was not favored and talked about how that was part of their relationship dynamic. And I was able to facilitate a conversation between those two parents. But at the same time, that child and parent had their own separate safe space to process that. And then I had permission to speak to the family therapist. And that's when I talk about collaboration. So the family therapist and I are working together to talk about how the dynamic is playing out between parents, how the dynamic is playing out between parent and child, and ways that we can work collaboratively to support both sets. In other situations, I've had a one-off where it might be the two parents and the child come in for a couple of sessions and we talk together, right? I think really it's on a case-by-case basis, but if they're I would recommend a family therapy in a case where a kid is getting to that age, they're feeling unheard, they're seeing some patterns of things happening, but really making that something that's between that parent and that child, as long as that parent is open to engaging. A lot of times the favorite parents will say, well, I've got to teach them how to deal with that parent's behavior. You know, I've got to teach them, but I don't want them to then recreate a negative process that's really based in their own relationship with the person. I want that child child to build their own ability to cope with their parent, because it's a different relationship.
Thank you. Siblings. Really great question. How would you approach conflicts that arise among siblings when one child favors a specific parent? So there might be differences within the family and siblings.
It's so typical and so hard. And when we talked to custody evaluators, when I was at the conference last week, custody evaluators and guardians, they have to work from each child's perspective separately, because each child is a person with a different relationship, right? And so we have had situations, or I've had situations where I've got one kid that wants to go and one kid that doesn't want to be bothered, right? One kid who wants to be bothered all the time and the other kid's like, leave me out of this, even in terms of court proceedings. And so what I say is that we treat the kids as individuals. If there is a parenting plan established and the parenting plan says that both kids have to go, both kids have to go. We do validate, we say, I understand that you don't want to go. I understand that you're feeling really anxious about it. I think we should talk about ways to make the trip, make the weekend more palatable. So how can we set up something with your mom so that she knows that this is difficult for you, and we have come up with a system for you making it through the day. But when it comes to like custody evaluations and guardian ad litem evaluations, we look at each child separately, right? But at the end of the day, you're not going to have 5 different parenting plans, right? You'll likely have one parenting plan, and children will have to adapt. But we want to make sure that the children know that they can express themselves and say what's working for them and what's not working for them. There comes a certain age where you can't force an 18-year-old, 17-year-old to do what you force a 7-year-old to do, right? So if you got differences in age, there's going to be differences in policies.
There are others, and please keep them coming in. I had a question, because I think a lot of what you're describing, you have multiple systems. You have the judicial system, of course, multiple therapists, coordinators, advocates, and then therapists. But what I'm also wondering is, so a lot of times, especially when there's court involvement, right, that becomes in some ways, or can become, the basis for activating the client, right? So in many ways, it may be mandated, or it might be forced, or it might be necessary as part of legal proceedings. But what I'm curious about is, if someone out there is working with a family where there's high conflict, but there's not court involvement, what would you do to activate that? How would you approach that, right? This is very common, right? There might be, again, conflict without court. And I think even going back to the point earlier made about how many of these aspects of court involvement and resources that are available are cost prohibitive. So there are families that might be going through these kinds of issues. How would you approach activating, motivating families, parents, children into treatment without that system's pressure, so to speak?
It's really difficult. I've had a couple of cases that have come to me where there have been, so I'll talk about one level will be cases that I get where there are attorneys who are trying to mediate, but there's no separate guardian ad litem who's determined what's in the best interest of the kid. And then I get put into a position as a therapist of trying to figure that out. And I try to avoid that because it's not in my lane, right? And in those situations, I'll say directly to an attorney or to the attorneys, you all should have a guardian involved. Really, we should not be doing this work if there's not a guardian involved who is doing a full investigation, who is an uninterested third party, who is interviewing the kids, figuring out what's going on, talking to teachers, talking to all the players in the situation so that we get a clear picture. When you're working with a family who hasn't even come from the courts, I think that's the point to refer them to, right? Is to say, you all need to get in contact with a guardian, even if it's for a consultation about your case. The issues with it's so expensive, right? And I think the issue is figuring out resources that you can give to people that are low cost. So, right, if I have a family that is not mandated by court, but I'm noticing this level of conflict, I might say, you need to check out this online course, right? We're getting to the point where I'm unable to work with your child effectively because your child is reporting that you all's conflict is so high, right? And so if I'm the child's therapist, then I'm saying, perhaps you all should check out a high conflict co-parenting course, even if it's something online, even if it's something that's through the state. You all need more help. I can't, your child is not going to get better without more help, right? And so it's hard, but I would refer them back to like an online high conflict course, or to say, you all are going to have to think about engaging with a guardian. If you don't have the money to engage with a guardian, here's the Atlanta Volunteer Lawyers Foundation, or here's what Kings County court system offers. Here's what Manhattan offers, right? Trying to kind of do some of that work. And if all else fails, I'm going to a large organization like AFCC, where I know that they work across states and that each state has a chapter. And I can reach out to one of those chapters to find out what are the resources that are available at a low fee.
Okay. Yeah, I'm trying to figure this one out a little bit, because I think there might be some comments in response to other comments, so I'm not sure of the context.
Okay.
So there's a comment here about when there is, or a parent has mental health or behavioral health issues, mental health or addiction issues. Kind of goes back to the accumulating ACEs. And sometimes the child has legitimate concerns independent of the favored parent.
Yes.
I think so it might be that favored parent may also be the parent who has these issues, if I understand correctly. This is often unaddressed in the court proceedings, and the children are forced to engage in an unhealthy engagement. Oh no, okay, I'm sorry. So I think it is when there are mental health and addiction issues. Okay, got it.
So let me talk to you all. So the process by which that gets addressed is called a parental fitness evaluation or custody evaluation. A parental fitness evaluation is going to be conducted by a psychologist. They're going to do personality measures. They're going to do testing. They're going to collect data about substance use and abuse. We've had, people get drug tested. We look at their history, they will go through medical records to determine what's their current level of functioning, et cetera. And so if there are real legitimate concerns about mental health issues, substance abuse disorders, parents can request a custody evaluation or a parental fitness evaluation. Now, when you open yourself up to that, both parents really need to be evaluated. It shouldn't, now, in many cases, the parent that presents with the substance abuse disorder is the only parent that is evaluated. But really, when we're trying to figure out like the best interest of the kid and what's happening, both parents could be a part of that process and they could both be evaluated. But that is what you want to request from the courts, right? Or that's what you want to tell parents to request if they have concerns about ongoing visitation in light of substance abuse or mental health issues, right? When you have a licensed psychologist who does that evaluation that's accompanied by the testing that's done, we give personality measures, other measures, then we can really make the case for, okay, there's something that is happening here, and that person can make recommendations for what visitation should look like.
Gotcha. Yeah, and I think the person who had that question did also have to clarify that the issue is, right, when the favored parent is the healthy parent, right? So there is an alignment there, of course, with the favored parent who is the healthier parent,
right?
And those difficulties. But I think it also highlights that question that you raised earlier, that is so important. And if you can clarify, right, in those instances, I think what we heard you say is that in part the contact is important.
Yes.
That contact with both parents, favored and rejected parents.
Yes.
Difficulties are important. I don't know if you could say more of that in that context then, because I know you're talking legally,
right,
on the legal side, and what the system can do.
Yeah. So let's say we've got a parent who is active, like we're not going to take away contact because a parent has a bipolar disorder diagnosis. Like we're not going to, that's not what's going to happen. But if a parent is manic and they are engaging in behaviors that are threatening, that are dangerous, then we are going to engage the courts to say, hey, I have some concerns. My kid told me they were in a car and the car was going at 160 miles an hour and dad would not listen when, or mom would not listen when the kid told him to slow down, or the kid was left in this place and for hours and parent didn't come back. I have some concerns, right? So we're definitely going to say something, speak up. And in those instances, the favored parent may have to reach out to a protective services or to the courts and say, I know that my child is supposed to have visitation, but I have some real concerns about mental health currently, right? Just a diagnosis won't suffice. I was going somewhere with this. Can you remind me of the second part of the question?
Well, just I think from a therapeutic perspective, though, like that child may have those resistances to meeting with the registered parent. Yeah.
Because there's a legitimate concern about their safety. They've been through something when they've been in that other parent's care while that parent was under the influence or while that parent was experiencing emotional distress, right? And so we don't want to say, oh, well, you've got to go in that situation. But first step is we've got to alert somebody that this has happened, right? So we've got to call this out to either protective services or the courts, if your court involved the guardian. And the next point is going to be that you are going to request like a parental fitness or custody evaluation because of these concerns, or you're going to request some supervised visitation. That supervised visitation can be formal, that can be done with a company, right? So when the supervised visitation is formal, there's a company that you work with, they have a location or they come to you. The visitation occurs for a set amount of time with another party there who is trained to be there. And the contact is structured.
Right. So, but I'm curious, yeah, and I think, yes, those instances where there may be danger involved because of that. But what I'm curious about is, so if you're working with the young person who's saying, I don't want to meet with mom or dad, just not because there's any danger, but because they're not mentally healthy. There may be other ways in which a young person might be resistant to meeting with the rejected family due to mental illness. Maybe just like mom's always down or dad's always down or that. So I'm just wondering, where do you work with that and the young person in addressing those issues? Yeah. Aside from the legal ramifications.
That's a developmental thing too.
Exactly.
So I've had some really young kids who were in a position where the parents' mental health status, there was definitely something going on. And you would see it in the kid is questioning, why isn't the parent consistent? Why does the parent say certain things? Why does the parent behave in certain ways, or explaining things that happen? And in those cases, I've got to talk to the kid and the favorite parent. I've got to have messaging for the favorite parent about how they talk to and explain things to the kid. And then to say to the kid, there are sometimes when people are not healthy, right? Or they're experiencing a difficult time. And so they may say or do things that are unexpected. And when those things happen and they make you feel uncomfortable, it's really important that you talk to somebody about that. Or that you say to that parent, this makes me feel uncomfortable and unsafe, right? I also want that kid to have an avenue by which they can get in contact. Like, let's say they're on a visitation. I want them to have a way that they can be in contact with the other parent. Now, sometimes these cell phones can be a big hot topic item, but I do believe that it's important for kids to be able to have some way of getting in contact. And if I've got a parent and I'm not sure that that parent is going to allow the other parent to have contact, or that they're not going to answer the phone for the other parent, that would be a time when I would make a suggestion to both parents that the kid does have some device where the other parent can call them, but on specific times, or where if there's an emergency, that kid can reach out and make a contact, right? But I've got to teach this kid that they may see things that are unexpected. And they will know it's unexpected because they'll experience some changes in their body, or they'll think like this isn't right. And when they notice those things, that it's okay to speak up and to say, this makes me feel uncomfortable, or I'd like to call my other parent, or to say to me, this happened and I felt uncomfortable about it. That's really all they can do in that moment, right? And then after they've done that in that moment, then the adults in the situation have some responsibility. So I've got to reach out to both parents and let them know what occurred. If I have to make a call to ACS because there's something that's occurred, I've got to make that call, right? And so we want to make sure that we're always validating the kids' experience, letting them know that it's okay to say something, and that and if it's an unexpected behavior, that's really kind of, it could be a result of being under the influence of something. It could be a result of a mental health difficulty, right? But that was most important that they feel safe.
Yeah, you know, and I think there's a last comment here that, you know, and I think it addresses this issue about getting the child's perspective on how things are going, basically, right? And if you see any of that resistance, exploring it, because I think one of the comments that comes up is parents can very much present to agencies as put together, right, during evaluations and assessments, and that sometimes they may have underlying personality disorders, substance use that aren't known or seen by others, but the child does pick up on it. So
yeah, and that's why we want those guardians involved.
Yeah.
Because those guardians get collateral information, they do investigations, they can make sure that there's a custody evaluation that occurs. You know, the guardians are really good at getting multiple sources of information that many times can corroborate what a kid is saying, right? And so then that guardian is that independent person can come and say, hey, the kid brought this up to me. I don't just take off face value. I also go and do some research and do some investigation, right? A lot of times parents will say to me, well, once this process is over, they'll just go back to doing what they did before, right? So that's a fear many times for families or people who are in this situation. And yes, that can occur, but the hope is that there are enough people involved who have professional expertise, who are not just relying on their own perspective or their own bias, but are saying, hey, we have some data to support this, and we got to put a plan into place.
Thank you, Kristin. Kristin, if you could do me a favor and advance to the last slide.
I will.
So Dr. Carruthers, thank you so much for many of the comments coming in are showing gratitude for this wonderful presentation. I learned a lot. I hope you all learned a lot. And this is a very complex issue. Please, please, please take a moment to fill out that survey. Give us feedback. And more importantly, give us ideas of additional topics you'd like covering, again, this space or other spaces related to children's mental health. So thank you all for joining us today. I know there were a few more questions, but in the interest of time, I just want to make sure we end. And then also, again, one more time, Dr. Kristin Carruthers, thank you so much for an amazing presentation. And thank you all out there in the audience for the work that you do and for joining us today.
Thank you so much for having me. It's been a pleasure. I appreciate you all for listening.
Thank you.
Thanks.
Take care, everyone.